Dr. Jackson, whenever you get ready,
Okay.
let me let this move, is setting up.
Yeah, and it's 4:59.
Yes, ma'am.
Okay, it's now 5 o'clock. I'd like to call to order the Durham County Board of Health meeting, and a little adjustment to the agenda right off the bat. We're going to turn things over now briefly to Attorney Wardell.
Thank you, Vice Chair. The first order of business is for you as the Vice Chair to be affirmed as the new chair of the board. That is pursuant to the rules of procedure for the Board of Health. So that would just require an affirmative vote of the majority of those present. And so if Roz could do a voice vote, we can get that done. Once that's done, as the chair, you would appoint a vice chair from those who are available and who would like to do the position. You can pick one and appoint them as the vice chair to serve out the remainder of the term for the prior vice chair.
Okay.
Thank you, Attorney Wardell. All right, so Dr. Jackson would not vote, correct?
Correct.
Okay. Dr. Miller, Dr. McDougall, Mr. Curtis.
You're muted, Spence.
You muted.
Yes.
Thank you. Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Alam.
Yes.
Thank you.
All right, congratulations, Dr. Jackson. You now have the
Mhm.
awesome responsibility and weight of being the chair of the Board of Health. By far the most established and esteemed board that Durham County has. So,
Amen. Amen.
so
Oh,
now,
well, thank you so much. I do appreciate the vote of confidence, though. So thank you for that. I don't know if you all know, most of you may know that I actually got my first 2 career starts at the health department. First as a public health nutritionist, and then years later as the medical director for women's health at the health department. And now I'm its board chair. How about that? For a little while anyway. All right, so I will take a volunteer to serve out the rest of this short term here until January as vice president.
I'm not interested in serving, but I'd like to recommend Mary Braithwaite.
Does that need
Okay,
a second? Because I would second that nomination.
well, are you willing to do it, Dr. Pratt?
I think her silence gives consent. That's what my mama says.
Yes. Thank you for the nomination. Thank you.
I second.
Excellent, excellent. All right, so Mary Braithwaite, Dr. Braithwaite is our vice chair. Thank you, thank you.
Welcome.
All right, so now we'll get back to our agenda. So are there any other items to add or adjustments that need to be made to the agenda?
Madam Chair, yes, ma'am. We do have an additional budget amendment to add for the board's consideration.
Okay. So instead of 2 amendments, there'll be 3.
That is correct, Madam Chair.
Okay. Any other adjustments or additions? All right, so I'll take a motion to approve the agenda with the addition.
I approve.
Seconded.
Okay. We'll do a roll call vote.
Dr. Jackson,
Approve.
Dr. Miller,
Approved.
Dr. McDougall, Mr. Curtis,
You're muted.
I approve. I'm sorry.
Dr. Braithwaite,
Approve.
Dr. Orto,
Approve.
Dr. Ray,
Approved.
Mr. Brown,
Approved.
Commissioner Alon.
Aye.
Thank you.
Okay, thank you. All right. Our minutes from our last meeting were in your mailings. Are there any additions or corrections to the minutes? If not, I'll entertain a motion to approve.
So moved, approved.
Second.
Okay. Roll call vote.
Chair Lady Jackson,
Approve.
Dr. Miller. Dr. Miller, you're muted. I think he's stuck.
He's frozen. Yeah.
Yes, Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alon.
Aye.
Thank you.
Okay. Minutes are approved. Are there any public comments? Okay,
No, ma'am.
all right. Staff for program recognitions?
Madam Chair, no specific recognition, just want to continue to lift up this wonderful staff that continues to do a fantastic job throughout this COVID pandemic experience. We are experiencing somewhat of a lull, and we will take it, but they continue to fight the good fight, and I am most grateful for their service to public health and our community. That is all I have.
Okay, great. Thank you. And I just want to say, I guess out loud, that we appreciate the service of Mr. Eric Ireland and his time on the board, and actually his work at the health department. So he will certainly be missed, and we do wish him the very best. Okay, administrative reports and presentations. The 2020 Community Health Assessment. Ms. Miller.
Good afternoon. Thank you so much. My name is Bria Miller. I'm the Partnership for Healthy Durham Coordinator here at Durham County Department of Public Health. And it is truly a pleasure to be here speaking with you all. Thank you, Board of Health, for having me here today. Also, hello, Director Jenkins, Deputy Directors, and my supervisor, Marissa Mortiboy. I'm going to go ahead and share my screen now, and I will go ahead and tell you all, unfortunately, something strange is happening with my Zoom, so I am actually unable to see you all. So if there's anything that you all cannot see, or if I'm frozen or anything like that, please do come off mute and let me know, because I won't be able to see your faces. Are you all able to see my first slide?
Yes. It's not in presentation mode though.
Okay, let me stop the share and try to go back again. Are you all able to see my screen?
Yes.
It looks as if it's trying to load.
That's what I'm seeing on my side. It says it's not responding.
Yeah.
Okay. But I don't want to hold up the meeting. So if you all are okay with it, I can just present the information. I think someone has my slides, but I'm comfortable also with just speaking.
Okay.
Okay. I'll start here. Try one more time. Okay, are you able to see it now? Yes.
It's thinking.
Okay.
Yes, we can see it.
Thank you. Okay, so the community health assessment. The purpose of the community health assessment is to provide a comprehensive set of valid and reliable information about the health of the Durham community. We want, of course, to make it easy for members of the Durham community to access and understand the information. This is done every 3 years in partnership with the Durham County Department of Public Health, of course, as well as Duke Health. We also partner with community organizations and get buy-in for this process. This is actually unique to Durham, and the partnership has received recognition. So here are some highlights of the 2020 Community Health Assessment. Durham's community survey was carried out by 243 community volunteers, partnership members, Durham County Department of Public Health staff, and Duke Health staff. 612 residents were surveyed in the countywide and Hispanic or Latinx neighborhood samples. And the Hispanic or Latinx neighborhood samples are defined as any neighborhood with 50% or more of the Hispanic or Latinx population. There are 15 chapters and 50 sections. As you can imagine, this is pretty large as it is 532 pages. So thankfully, we also have this available in PDF. Here are some key findings. Racial and ethnic disparities exist across nearly all health outcomes. Structural racism and historical policies such as redlining, immigration laws, and segregation are causes of health disparities. We also know that issues are linked. For example, housing issues are also access to care and food insecurity issues. Top ways to better support communities such as transportation, crime reduction, physical activity, infrastructure, affordable housing, access to care, education system improvements, and stronger communication and outreach to community could also address some issues that impact quality of life and top health concerns. Also, the majority of residents feel safe where they live in Durham. All right, so I'm going to highlight the top 5 health priorities. The number 1 priority identified was affordable housing. 31% of Durham households are defined as being cost burden. This means that 30% or more of the monthly income goes directly towards housing. Reasons for this include historical policies such as redlining, poverty, and gentrification. The next one is access to healthcare and insurance. An estimated 12.8% of Durham County residents were uninsured in 2019. There are a number of reasons for this, but a few are cost of insurance, employment status, immigration status, and treatment of the healthcare system by the healthcare system. Next is poverty. 25.3% of respondents in the countywide sample were at or below 200% of the federal poverty level. Black and Latinx populations with 18.4% and 26.8% living in poverty respectively, compared to 10.5% of the white population. Next is mental health. So about 17% of respondents reported that they had experienced poor mental health 15 or more days out of the last 30. Durham has about 1 mental health provider for every 180 residents, but this is a better ratio than we have statewide. Next is obesity, diabetes, and food access, or some people may know this, ODAFA. So we know that the ability to eat healthy foods is influenced by socioeconomic, educational, and environmental factors. Poor diet has surpassed tobacco use an underlying cause of death. 10% of people surveyed reported skipping meals because they didn't have enough money to buy food. Also, 12.9% of Durham residents surveyed had diabetes in 2015. So now I'm gonna give you an overview of the 2020 Community Health Assessment process. So back in 2019, before we had COVID going around, we were able to go door to door to complete the surveys. After that, we analyzed the data and we were able to produce reports. Next was the writing process, where we got together with other community organizations who had different areas of expertise, and we wrote this document together. Next, we released a final draft and received feedback from the community. After that, we conducted listening sessions. They were planned to happen in 2020, but of course, COVID came. So we conducted those listening sessions this year, and we were able to have sessions in both English and Spanish. Now we are preparing to kick off our community health improvement plans process, and we're going to host a community meeting Wednesday, October 27th. The priority areas are going to be set, of course, by the information from the community health assessments, and we are going to have a specific focus on equity. Some new things that were in this community health assessment. We had an intentional framing around equity. Each section provides context for disparities seen by race, ethnicity, gender, education, income, sexual orientation, ability, and more. We also included a chapter on climate change. There was a focus on the COVID-19 pandemic and impact on different populations. We also continue to use a random sample and to survey Durham's Hispanic or Latino residents, as well as the overall county's residents. So next, I want to show you what respondents had to say whenever we asked on both surveys what people, places, or things make Durham a good place to live, because we wanted to include an assets question. So there's some things that stand out here. Of course, we see big and green in the middle, good people. People say that it's safe, it's quiet, there are kids, recreation options, and accessibility to other places. And this is from the county-wide survey. And here we ask the same question to the Hispanic or Latinx population. And we do see some things in common, like good people. Also that it's safe, quiet, and accessible to other places. There are some other things that stand out here, such as a sense of community, parks, and the neighborhood. All right, next, I just want to point you in the direction of where you can find other data and reports. They are on our website at www.healthydurham.org, where you can actually find this full report. You can also find the community health assessment executive summaries in both English and Spanish, and all of these can be downloaded by PDF. Thank you so much. Here's my contact information. I'm here if there are any questions.
Thank you. That was a really good report. I do have one quick question. The session on October 27th, Wednesday, how is that being broadcast? I mean, if we wanted to attend, how would we do that?
So I am in the last stages of actually creating a flyer. We have been announcing it in a number of meetings as well as in our newsletter, but we are sending that through different email chains and listservs so that people are able to register via Zoom. It's very easy. We actually have the QR code where people could go on directly through the link on Zoom to register for that. Also, we'll be streaming it from our Facebook page so that people can interact in the chat there.
Okay.
And Dr. Jackson, once they confirm everything, I can send that out to you guys.
Yeah, that'd be great.
Okay.
All right, thanks.
Madam Chair, if I may, I'd also like to, really give huge props to Bria and Marissa Mortarboy and team, particularly Marissa, for getting us over the finish line. Upon submission, the state did marvel at the fact that we were able to get it done amongst a raging pandemic, whereas a lot of counties requested extensions and delays. We got it done. So again, just want to give huge shout out to Marissa and team for making it happen.
Yeah. All right. Any other comments or questions for Ms. Miller? All right. Thanks again so much, Bria.
Thank you.
Okay. We'll move on. Mr. Sutton, a fiscal year in financial report.
Good afternoon, board. My name is Will Sutton. I am the finance administrator for the Durham County Department of Public Health. I will be presenting to you an overview of our financials for fiscal year ending 2021. But before we get started, I want to say that I can sum up the results of this year in 4 words. 4 words. COVID, 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 COVID. You will hear that word echoed throughout this presentation because it affects all of these numbers. So let me share my screen. And let me know when you are able to see it.
Yes, we can see it.
Okay, great. Let me start here. Uh-oh. Okay, here we go. I need to click my mouse. So on this first slide, I normally like to start with an overview of our original budget that was approved July 1 and where we ended the fiscal year regarding the budget. Now, as you can see, during the year between the approved budget and the ending, there was a huge increase in our budget. And the reason behind that increase, COVID grants. Fortunately, we were able to receive a substantial amount of COVID grant funding to be added to our budget throughout the year. And that is the main reason why the influx or the increase of our budget for that year. But let me kind of delve in a little deeper to show you what this number means. So the total budget, the total expenditure budget when we began was a little over 27 million and it ended in 36 million. So out of the total budget expenditures, the other funding represents sources that the county did not have to provide, like the grants, fees, Medicaid. That's what the county does not provide. The difference between the total and the other funding, that's what the county is chipping in to balance this budget. I like to show this slide to show what percent that the county is funding for our budget. Normally it's 70, 71, 72%. But as you can see, it began with 69% and we ended with 61% after those COVID grants began to come in and begin to be added to our budget. So overall, what the county contributed to our budget was a decrease of 9%, directly related to those COVID grants that came. Okay. So in this particular slide, I get a little deeper into the details of the expenditure budget. It's broken down by our Managing for Results programs. Now, the takeaway from this particular slide is, of course, the difference between the current budget and what was spent that year. Notice that the unspent funds, call it 8.8 million. But so why is that? Of course, 2 reasons. So 1, the COVID grants. In total, we received about over 5 million in COVID grant funding this fiscal year. Now, we didn't spend all that fiscal year. About 4 million of that was left over at the end of FY21. Unfortunately, they provided those same funds to us at the beginning of this current fiscal year that we're in. So not only are we still spending some of the grant funds that we had originally received in FY21, in FY21, but there are also some new grant funds that we received in this fiscal year. But again, the takeaway from this particular slide is knowing that, those COVID funds came in, increasing our current budget, and we didn't really spend them all this fiscal year. And if we look specifically at medical services, you can see that at the end of the fiscal year, they were at 73% usage. The majority of those COVID grants were added to this particular budget, the medical services program budget. So that is why you're going to see 73% usage, because a large portion of those grant funds were left unspent, but again, they were carried forward to the next fiscal year. The only other one I want to point out is the Leadership and Business Management Program. That's at 64%. So in addition to COVID, there was also CARES funding that the budget department and county finance added to our budget. And when they added it to our budget, they didn't break it down. They added all of those funds into the Leadership and Business Management Program. It's about $2 million altogether. So that's why this particular budget is at 64% is spent for that particular fiscal year. So again, COVID and the CARES relief funding. Go to the next slide. Now, in this one, I just showed kind of overview of the actual expenditures, a breakdown between the personnel and the operating costs. The takeaway from this is that most of our budget is personnel, of course, as most budgets for most companies, personnel. But over the previous fiscal year, personnel costs and operating costs increased. So last year personnel approximately 16.5 million. And last year, the operating budget, actual expenditure was about 9.7 million. So there is an increase there over the previous fiscal year. So just a kind of overview of the different, the breakdown of the personnel to operating in all of the public health budget. In this slide, I begin to talk about the revenues. And there is a typo on here at the top that says exclude Medicaid cost settlement. Normally, I do exclude Medicaid cost settlement from these numbers, but actually this time I included the Medicaid cost settlement. And I think in the next slide, it'll be broken out separately. But the takeaway from this is, of course, you can see totals. The current revenue budget, 14 million. Revenues received, 8 million. Of course, again, that goes back to those COVID grant funds that came in that increased the current budget, but yet we didn't end up spending it all in this fiscal year because what was left over was provided to us at the beginning of this fiscal year. And the same thing rings true for the medical services budget. Again, that's where the bulk of the COVID grants were housed, which is why that percentage is low. Again, there was over 4 million left over from those COVID grants that were carried over. And in the leadership and business I guess that's the main takeaway. And the 61% for health education and community transformation, they had a number of grants that did not go fully utilized that particular year, such as the jail testing grant, the ITTS grant. There were several grants in there that's making up that or it contributed to that 61% usage of this particular one. But again, main theme, COVID, all throughout the year. In this slide, I just give you a visual breakdown of the total revenues for the entire department. A couple of things that I want to point out on here is our cost settlement. Now, we did receive our FY20 cost settlement we received it in time enough for county finance to allow us to record the revenue in FY21. But it was about 2.1 million. So the cost settlement for FY20 is about 2.1 million. That other 400 some thousand, we did receive withholdings from prior fiscal years. So each year of cost settlement, they withhold 10% until they do their final settlement. And once they do their final settlement and all the numbers are correct, then they give us that 10% that's withheld. So included in this 2.1 million for FY20, there's another 200 some thousand that was withheld from FY17 and another 200 some thousand that was withheld previously from FY18. We received those in this year also. So that's why there's 2.5 billion. I think everything else is kind of straightforward. Small amount of donations that was with, I think it's Bull City United during the fiscal year. Insurances, which are, the commercial Blue Cross Blue Shield, Aetna, Cigna, and our self-pay fees. So this is just a visual representation of all of the fees for public health department. So in this particular slide, I kind of present the grant revenues apart from all the others, just so that we can compare current year to previous years. And from FY19 to 20 to 21 is a little dip and a little rebound. And of course, COVID. Of course, we were dealing with COVID. It began the latter part of FY20, which, as you can see, and also we were dealing with that malware attack around that same time. So at that time, a lot of our focus began to shift from our normal jobs to COVID, directly reflection upon the usage of our grants for that fiscal year. The reason that it rebound up is in FY21 as far as grant revenue, of course, all of that COVID grant funding that we received. In total, about a little over $5 million in grant funding. But of course, we didn't utilize it all. But that is the reason why there's that dip in FY20 and then the rebound for FY21. There's a lot of COVID grant funds that were received in this number right here. Okay, on the next slide, I kind of break out Medicaid revenue so they give you a visual as well. And this is COVID too. COVID really affects this. So as we were shifting our focus at the latter part of FY21 to COVID response, that continued into FY20, the COVID response. And it'll be if depending on how things go from this point regarding COVID, I believe that our Medicaid revenue is going to bounce back, provided everything goes as we want it to regarding COVID. But I'm pretty sure we're all getting tired of dealing with COVID. And our self-pay fees, between 20 and 21, there's a slight increase, not really a big difference. But the one takeaway from this particular slide is that in FY21, we transitioned to a new medical record system, EPIC. one huge benefit of that particular system is allowing online payments with ease. So as I'm seeing activity since go live, which was in I think February, March, on up in the present, I'm noticing a lot of online activity, and that's a good thing. So going forward in FY22, definitely expect Selfpay fees to increase as a result of the ease of paying, and as a result of going to the new system. It gave an opportunity to pretty much evaluate all the processes, especially the ones dealing with verifying income and checking eligibility. So definitely expect an increase in fees going into fiscal year FY22. So that is an overview of how we did in FY21. And again, the takeaway that affects everything was COVID, 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 COVID. Any questions or comments?
Thank you, Will, and more COVID.
Yes, yes, yes. All right, thank you for your time. I'll stop sharing.
Okay, thank you very much. So if there are no questions or comments for Mr. Sutton, we will move on to school nurse program COVID-19 activities. Nurse Cheryl Scott.
Hello. I'm trying to make myself, can everyone see me fine?
Yes.
Okay,
Yes,
great. My name is Cheryl Scott. I'm happy to be here this afternoon. I'm going to talk to everyone a little bit about what school nurses, public health school nurses are doing in Durham Public Schools. Those are schools we're assigned to. I won't talk very long, be very brief. Well, let's see here. Oh, Lord. Can you all see my screen?
No.
No, okay. Try this again. How about now? Can everyone see my screen? Excuse me?
We can't see it, Cheryl.
No, we can't. No.
Okay. Help. I have help.
Marcia to the rescue.
Yes. I love Marcia.
I know. I need Marcia to come to my house.
What is this? How about now? Oh, no.
It's in presentation mode.
Oh,
Right.
no. Okay. And now,
Got it.
thank you, third time's the charm. Thank you for your patience. Thank you, Marcia. Good evening. My name is Cheryl Scott. I'm the Child Health Clinical Outreach Program Manager in Medical Services. Lisa West, the School Health Program Manager, and I prepared a brief presentation to share public health school nurse COVID-19 activities in DPS. So as nurses, assessment is the key. That assessment includes not only the student when they present in front of us, but it also includes any psychosocial concerns as these may impact with the treatment, nursing care, the ability to do our assessments, the severity of illness, etc. So when we see a student, we not only see that student presenting before us, but we also have to incorporate and assess their vulnerability as far as chronic illnesses, where they live, are they homeless? Do they have a home? Mental health, behavior concerns, food insecurity, things of that nature. So that is included in our assessments as well. So our assessment, implementation, planning, evaluation. What we want to make sure is that first of all, we enforce masking. We want to make sure that when children cough, they cough into their elbow or their sleeve. No touching eyes, no touching nose, nowhere in your face. Students or staff may exhibit symptoms while in school. And once that staff member or the student develops symptoms or display symptoms, the ability to learn and teach are going to be decreased because they're ill. They don't feel well. And they may be at risk, where they will be at risk, for spreading this illness to others. So students who develop symptoms while at school are going to be placed in an area separate from other students and staff. There's a designated isolation room in each of the Durham public schools. After the assessment, and the child's parent is called, to come pick them up. And then there's a discussion as to whether the child may need to go to the doctor, hospital, but of course that's the parent's decision. We provide information, the parents make their own decision, Once that student is out of that room, it's disinfected and cleaned and disinfected by school maintenance staff. The room is basically off limits to everyone until that room has been cleaned, and no one goes into the room after it's cleaned unless it's another student or staff person who needs to be isolated. We provide our education to the students through Strong Schools North Carolina Public Health Toolkit. I'll talk a little bit more about that in just a minute. Also, we have a clusters team here in public health. The clusters team is led by one of our school nurses, and we have participation in it with, of course, our surveillance team. And what we want to make sure of is that we have this information that you see on the screen. We need to know who the student has been exposed to. Do they participate in sports? When was the onset of symptoms? Any test date? Close contact? Any travels to communities of high transmission? And public health and Durham Public Schools meet weekly to talk about these cases, the clusters cases. Okay. The Strong Schools North Carolina Public Health Toolkit is closely aligned with the guidance from CDC and from the American Academy of Pediatrics. It emphasizes everything possible be done to keep the students healthy, and it really emphasizes masking. Very briefly, the K-8 should require, or is recommended that they require all students and staff to wear the mask indoors, regardless of the vaccination status. 9 through 12 is to ensure anyone who is not vaccinated, including students, wear a mask indoors. This guidance was first published in June of 2020. It was updated this month. The state encourages local school leaders to work with public health, and that's exactly what we're doing now. We meet weekly with DPS to talk about these clusters. clusters team is made up of these individuals. Like I said earlier, a public health school nurse leads it, along with the DPS lead nurse. They act as co-leads, actually. We have our public health executive leadership and DPS assistant superintendents provide our guidance, directions, and we have school health program leadership. And of course, we have our public health COVID-19 surveillance team. So we have our experts, so to speak.
Excuse me for a minute, Cheryl.
Yes, ma'am.
So someone, if everybody can check your mute button, somebody is unmuted and we're getting a lot of background noise. There you go. Thank you. No, somebody's still unmuted. Okay, there you go. Thanks.
Okay. Okay, thank you. As you'll see the sign here, we can't mask at how excited we are to see you. So we're trying to get in, this is a not so subtle subliminal message, wear mask. Our third major activity, in addition to being in the schools, our clusters team, we participate in outreach events. This is one that was conducted, held, I should say, last month. It was a back to school bash. We collaborated with North Carolina Central, Durham Public Schools, Bull City United. We were there, and a few other agencies were there. There was music, there were backpacks, public health distributed backpacks. Excuse me. It was a vaccination event. People were able to be vaccinated there. Of course, we had our resource nurses that provide the education and information. The vaccinators, the nurses, and you see here that we had a table out there. The school nurses had a table out there. And we also had an unofficial mask control. And these were staff that took turns just simply walking around saying, hello, could you pull your mask up? Hello, do you need a mask? We'll get you a mask. And we would come back down on the other side and a person would have removed their mask again. But we went around so many times, people would see us coming and just immediately pull them up. So we figured that was better than not wearing them at all. So that's the end of this presentation. Like I said, it's very brief. Liesl, West, and I thank you for your attention. Are there any questions?
Any questions or comments for Nurse Scott? So then, Nurse Scott, it seems like, so are you all finding that the students that are showing up to school are being pretty much cooperative?
Pretty much so, yes, ma'am. Yes, pretty much so. That's really enforced. It's been enforced at the open houses that they had before school started. A lot of nurses went to their open houses, and that was one of the things that we emphasized. Not only is it protocol to wear, but we more so emphasize that that's going to help your child be well, stay well, emphasize hand washing, and your support is very much appreciated. So yes, we've seen very good participation with that. No problems, no major problems.
Okay. All right, great. Thank you. Thank you for that presentation.
Thank you all. I appreciate it.
Madam Chair, members of the board, the only thing I'd add to that great presentation is that Durham County is at such an advantage of having the public health, school health nurses to be embedded in public health. I talked to a lot of my colleagues that have so much trouble with getting the school health nurses that are not theirs, if you will, to really participate, help them out. They truly are unsung heroes because when it came to the early days of the pandemic and all the things that we had to do, we simply would not have made it without the school health nurses. Of course, schools were out, so they really tackled a lot of our early primitive surveillance efforts when we truly didn't know what we were doing. The school health nurses, mind you, we had a malware attack. So we actually had them writing down case investigations and everything. So I would be remiss if I did not give them props. And they continue to do a good job. As she mentioned, our clusters team is led by a school health nurse, and we do our very best to have that extraordinary partnership with DPS. So we're grateful for that.
Yes. Thank you to the school health nurses. All right. We'll move along. So public health vacancy report. Any questions or comments? Not looking too bad. Things look to be improving a little, Director. That's good. The public health NOV report. Questions or comments? I tell you what did stand out to me in the report this month was all the red. So there's been a lot of activity. And I noticed that there were only 3 entries, I think, that were earlier than 2020. So kudos to environmental health and doing all that hard work and keeping up. So thank you. And our health director's report, any comments, questions? He's busy. Public health is busy. All right, under committee reports, we need to reappoint a nominating committee. We've already elected a new board chair.
We don't need to do that, Dr. Jackson.
Oh, we
Ma'am.
don't?
No, ma'am. Thank you.
Now, the nominating committee, though, still has to, in January, we have to elect a chair and vice chair.
Yes, ma'am.
Again, I'm just filling out the rest of this year.
Yes, ma'am, that's correct. But I was, if you want to do it now, we can, but I was thinking we could do that in December and they will come
Oh, that's
back.
fine.
They would come back with a recommendation.
Okay. That's fine. We'll wait till then. Thanks. All right, under old business, 2021 Board of Health Operating Procedure Manual. Any questions or comments about that? I do have one comment, last question. I did look through it, and it mentioned that one of our committees is supposed to be a board committee that reviews annually that operating procedure manual. I don't know that we've ever had such a committee.
That's what this is. That's part of this handbook. So the last one that
Right,
was,
I understand, but there's not a separate committee. We just do it as a board.
yes, ma'am.
Okay.
Yes, ma'am. But if there are any changes that you guys want to do to that procedure, the Board of Health procedure, then yes, a subcommittee would be appointed.
Okay, gotcha.
Yes, ma'am.
Okay, if there are no further questions or comments regarding the procedure manual, I need a motion to approve.
Motion to approve.
Second.
Okay, it's been moved and seconded. We'll do a roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall sent an email. He is not able to connect for some reason.
Oh,
Mr. Curtis,
Yes.
Dr. Breakway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Alon.
Aye.
Thank you.
thank you all. Okay, motion carries. It's approved. Next, there are 7 Board of Health policies that needed to be reviewed. Any questions or comments regarding any of those? Okay, if not, I will entertain a motion to approve all 7.
Motion to approve.
Second.
Actually, there are 8. It's been moved and seconded that we approve the board policy updates as presented. Any further questions or comments? All right, we'll do a roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Mr. Curtis,
Yes.
Dr. Breakway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alon.
Aye.
Okay, motion carries. Under new business, budget ratification, Director Jenkins.
Thank you so much, Madam Chair. Under budget ratifications, we had a number of items that were sort of like agreed upon earlier. So the first of which was $8,000 that we received from the North Carolina Public Health Association. We received that as a means of us applying for what we call a mini grant, and Wolf mini grant, and it will allow us to restart our centering pregnancy program. So we thought it not robbery to apply for that free money, and we got it. So that is it for that one. The next one was one of the agreement addendas that we received for $115,000. That is a part of our efforts to work with the schools to establish a position to serve as a liaison between public health and the school district. And we've pretty much created the job description. We are well on our way. I wish that the funding came a little bit earlier, but nevertheless, we will take it. But that was that one. And the last one was in the amount of $39,000. And that is an agreement addenda that we received in order to promote health literacy. It came from the state of North Carolina. And we can use that money to do a number of things along the lines of racial equity. All local health departments are encouraged to do this. But the main thing that they really want us to form is sort of a council to really analyze and see how we can do things a little bit better when it comes to racial equity training. That is it for the budget ratifications.
Okay, thank you. Any questions or comments related to those ratifications? If not, I'll entertain a motion to approve all three.
So moved.
Motion. Okay.
Do I hear a second?
Second.
It's been moved and second. We'll take a roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Mr. Curtis,
Yes.
Dr. Breakway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Alum.
Aye.
Okay, thank you. Motion carries. All right, next budget amendments, and there are three of them.
Yes, ma'am. Madam Chair, the first budget amendment is in the amount of $3,627,190. And again, this is from the North Carolina Department of Health and Human Services, Division of Public Health, Women's and Children's Health Section, Children and Youth Branch, to complement the $115,000 that we received to establish that liaison position are these funds. These funds are for the purpose of, you guessed it, COVID-19. We are to support K through 12 COVID-19 testing. We are to provide COVID-19 support and response in the schools. And we're also to provide and support other school health program activities that foster healthy students in schools and ensure that they are ready to learn. Simply stated, they want no reason for why schools should have to go out of session. They want to make sure that we do everything that we can to keep our kids in school, and we've been doing that successfully. That is the first one. The second one for your consideration is in the amount of, oh, I apologize, no amount. This is just a budget amendment in order for us to increase an existing position that we have. That is a 0.6 FTE. We want to make that a full FTE, and it's for the purpose of establishing a full-time HIPAA compliance and contracts officer. That is one of the initiatives that I have, and it's hard to believe that a complex, multifaceted agency like this doesn't have one, but we certainly need one. It's been piecemealed. The lovely Rosalind McLean has been our contracts administrator for quite some time. And also Annette Carrington has been our HIPAA compliance officer. But as you would imagine, they have other full-time duties. It's much needed, and it's something that we certainly hope that you will consider. And last but not least is the budget amendment that we added. This is a budget amendment to approve the fee schedule changes and recognize $7,000 of additional revenue. We are constantly looking at our fees just to ensure that we are able to remain competitive and to also be able to ensure that we are able to generate the revenue needed in order to continue to be successful. Those are the budget amendments, Madam Chair.
Okay, great. Great. Yeah, and I agree with you. The HIPAA compliance officer, we certainly need that position as a full-time position. I can't believe Roz and Ed have been doing that. Wow. All right, any questions or comments regarding those budget amendments?
I did have a question. How does the compliance officer for the county interface with the, or how would the compliance officer interface with the full-time HIPAA and compliance officer?
As it stands right now, for the most part, they have an excellent relationship with a number of individuals to include Kiara, I'm blanking on the last name, but Kiara Simmons, who's our overall county HIPAA risk compliance officer, and they also interface with our risk, the county's risk management officer. This HIPAA compliance officer would also interface with the state's HIPAA council. We have an entire HIPAA apparatus that meets regularly, a little less because of COVID. But as earlier mentioned, it's a whole lot that goes into it. It's a full-time job within itself. And it's not really been given the justice and the attention that it's needed. Nevertheless, we've been able to be successful in making sure that those duties were taken care of. And then to the board, our most recent HIPAA compliance audit, we did extremely well. But of course, there were a couple of things that needed to be addressed. This is an action to make sure that those things get taken care of. Hope that answers your question, Attorney Waddell.
Yeah, and anything else we could talk about offline?
No doubt.
Okay, great. Any other questions or comments regarding the amendments? If not, I'll entertain a motion to approve.
Motion to approve.
Seconded.
Okay, it's been moved and seconded. We'll take a roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Otto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Long.
Yes.
Thank you.
Thank you. Motion carries. All right, agenda items or topics for the next meeting, our December meeting, the last of this calendar year.
Madam Chair, if I may.
Yes.
It is that time for the board's annual training. It is our suggestion that the December meeting be taken for that purpose. We do know that training is all encompassing and it may take an entire meeting, but it is something that is required for accreditation purposes.
Okay, great. Great. Yep, I see folks shaking their heads. I think we're all in agreement. That'd be good to do for December. And that's the only thing we'll add to whatever else our normal business is for that, for next meeting. All right, great. Any informal discussions, any comments, questions, announcements?
Madam Chair, I just want to take an opportunity to recognize and thank Dr. Anita Jackson, who has served as our medical director for quite some time. As a matter of fact, she walked in the door the same day that I walked in the door. And neither one of us knew that we would have a malware attack and COVID-19 global pandemic to contend with. But I just want to recognize all that she's done to keep us squared away. Not exactly sure if she's still on, the call, but I just wanted to make sure I recognize her in public as I've done privately.
Okay, thank you. Yes, I think she's still here. I wish she would show us her face. Dr. Jackson, on behalf of the board, I'd like to say thank you for all of the work and contributions you've made to Durham County over the past, almost 2 years, I guess, almost 2 years. So thank you very much, and be careful you're driving. Okay.
I am. Thank you very much. It's been my pleasure to serve the county, to serve with this great team. I wish Director Jenkins and all of the staff, the very, very best. They've got lots of work to do, and you certainly have an amazing team to do it. So thank you so much for the wonderful experience, the learning, and the service.
Okay. Well, thank you. Thank you. And we wish you the best. All right. Anything else for the good of the order? If not, I'll need a motion to adjourn.
So moved.
Seconded.
Do we have to do a roll call vote to adjourn?
Yes, ma'am.
Okay, let's go.
Chair Jackson.
No, I don't think we should leave.
Don't do it. Don't
No,
do
I vote
it.
yes. Yes.
Dr. Miller.
Let me think about it for a minute.
Oh, here we go. Here we go.
Yes.
Mr. Curtis.
Yes.
Dr. Braithwaite.
Yes.
Dr. Orto.
Yes.
Dr. Ray.
Yes.
Mr. Brown.
Yes.
And Commissioner Alam.
Aye.
Thank you.
Thank you all very much. Thank you.
Thank you, everyone. Y'all stay safe. Thank y'all so much.